My name is Dr. Tara Belija, and I'm a breast surgeon at Mount Sinai West. Well, first, you have to have a diagnosis. So, most women present with either a lump that they feel, or maybe they had breast imaging like a mammogram or ultrasound that was suspicious. Usually, they'll then go on to have a needle biopsy. And from there, we make a diagnosis of cancer, potentially, hopefully not. But if you unfortunately do get a cancer diagnosis, then we look at the images, we examine you, we get all the information from the biopsy, and then we make a decision as to the type of surgery that you need. So some women are able to save their breast and just have the cancer and a rim of normal tissue removed. Other women, unfortunately, because either the area of involvement is large or the mass is large, they may need to have their breast removed in what is called a mastectomy. And a lot of women qualify for breast reconstruction. You don't have to think that you lose your breast and you're left with nothing. A plastic surgeon can be brought in during a mastectomy to perform a reconstruction unless you're not eligible because have a lot of medical issues like advanced diabetes, you're on dialysis or other things of that nature. Well, I often find that most women ask their family members and friends, who's a breast surgeon that you've used in the past, and kind of get a gauge of that relationship that that person had with their surgeon. You can also talk to your primary care doctor or your OBGYN. They often collaborate with other breast surgeons and can give you a referral. If you go on the internet, obviously you're going to look at reviews. I would encourage you to look at the training of the surgeon you're considering. Fellowship trained breast surgeons specialized and took an extra year of training after general surgery residency to really specialize in breast cancer and breast surgery management. So you would want to look at that in your surgeon's training. If your surgeon maybe was trained farther back and maybe trained before the fellowship era, you'll just want to make sure that they specialize in breast and really perform mostly breast surgeries. The two types of breast cancer surgeries that we do are lumpectomy, where we remove the cancer with a rim of normal tissue around it. When we do that surgery for breast cancer, you oftentimes do need radiation afterwards. Or if you need to have your entire breast removed because you have a lot of area that's involved, or after your discussion with your surgeon, that's what you opt to do. That's full removal of the breast. There's different ways that we can do a mastectomy. Some women are eligible to keep their nipple and really keep a lot of their skin for their reconstruction, and that's called a nipple sparing mastectomy. Other women have what's called a skin sparing mastectomy, where you do remove the nipple and areola, but you leave a lot of the skin behind because that helps with your reconstruction. And then some women choose to not have any reconstruction after surgery. And a lot of women are actually increasingly choosing this option. And they're choosing to have something that's called an aesthetic flap closure. And that's where we try to make the the chest wall as flat as possible and to have a more appealing scar than some women have had in the past with mastectomy without reconstruction. And again, there's different types of reconstruction that you can have with the plastic surgeon. You can have an implant-based reconstruction, or you could have what we call a tissue transfer. There's different forms. Sometimes women choose to remove the muscle from their back and bring it forward, or they can take the stomach fat and tissue and bring that up, and that's called a deep reconstruction. But the best thing is that you talk to your plastic surgeon when you have their consultation with them. Some of the latest advances we've had, or newest innovations that we've had in breast surgery, really are the advances in different reconstruction options. In the past, a lot of women had implants placed behind the chest muscle, and that could hurt a lot. Sometimes it gave you that more lifted look after reconstruction. But a lot of plastic surgeons now put the implant on top of the muscle, so you have less pain. You can have a more natural looking breast after your reconstruction. And also with the deep, we don't remove any stomach muscles. So that's a nice option where you're really just removing the fat and skin. and putting it into your mastectomy site to make the new breast. And it's a very natural feeling breast, and that can often be done in conjunction with the implant. We also have a lot of new non-wire localizing devices. So let me explain that. Obviously, if we can feel a lump in the breast, we're able to make an incision and take it out. But sometimes there's things in the breast that need to be removed and we can't feel them. So traditionally, we put a wire into your breast, and obviously that can be very uncomfortable for a patient. So there's now new devices on the market that are sometimes there's little seeds. There's something called a Savvy device. There's something called an RFID device, and that gets put into the breast. It doesn't stick out of the breast, but we use a machine in the operating room, and that helps us find that needle in the haystack, so to speak, and that allows us to remove the tissue without a wire being placed on the day of surgery. So those are really good advances from a patient experience point of view. So your recovery time and return to normal activities will depend on the amount of surgery that you had. So if you had a surgical biopsy or a lumpectomy, those have a quick recovery. You can usually go back to work within 3 days. Usually most women are back to their normal activities at about 2 to 4 weeks, depending on what their surgeon's preference is. In terms of a mastectomy, it really depends on the amount of surgery, again, that you had. If you had a mastectomy without reconstruction, you can kind of be back to your normal activities in about a month. If you had reconstruction, that takes a little bit more in terms of recovery, and that can be about 6 to 8 weeks before returning to full activity. Basically, we take the results of the pathology report and we see what we found after we remove the cancer. The first thing we look at is whether or not the cancer has been removed in its entirety and has what's called a negative margin, meaning that there's no cancer at the edges of what was removed. If there are cancer cells at the edge, that implies that you may need another surgery and go back for either another lumpectomy, or in some cases, especially if there have been repeat attempts at getting a negative margin, sometimes you do need to go on to a mastectomy. Oftentimes with breast surgery for cancer, we also check lymph nodes. So sometimes you may need to go back for another surgery if lymph nodes are positive, and if your surgeon thinks that the correct decision in that case would be to go back. But obviously, we consider you to have a successful surgery if your pain is well controlled and if you're not having any complications after surgery. When you have a breast cancer diagnosis, surgery isn't your only treatment oftentimes. Again, everybody's cancer is different, so it really depends on the type of cancer that you have that dictates your treatment needs. So you have your surgeon who does the surgery. You'll get a medical oncologist who may recommend medications to lower hormone levels, which can be driving cancer growth. Sometimes you need chemotherapy after surgery. And sometimes, especially if you had a procedure that allowed you to save your breast, sometimes you will need to do radiation after your lumpectomy. And in some rare cases with more advanced cancers, you may even need radiation after a mastectomy. But basically, your surgeon and your team of doctors will come up with the correct treatment plan for you so that you have a tailored treatment to your specific cancer.